Now let's proceed to the ethnographic evaluation. Ethnographic evaluation is a method drawn from anthropology involving deep immersion in a group's culture, behaviors, and practices. Its key features is that the evaluator acts as a participant observer, integrating themselves within the group to understand its social dynamics. The ethnographic evaluation has a purpose to capture the cultural norms and interactions of the group. The application is that it is used in complex settings where understanding the culture is key to evaluating processes and outcomes, such as in healthcare teams. In a healthcare context, for instance, the culture within a hospital or clinical team significantly influences how care is provided, how teams function, and how decisions are made. For an example, the way a nurse communicates concerns to a senior doctor may be shaped by cultural expectations of authority and respect. Ethnographic evaluation can uncover whether this hierarchy facilitates or inhibits effective patient care. In the clinical settings, different wards or departments in a hospital may have distinct microcultures. Ethnography helps identify how these microcultures affect treatment processes or teamwork. In an intensive care unit, the cultural emphasis on fast decision-making and high levels of trusts between team members might differ greatly from a general ward where a more relaxed approach prevails. Understanding this helps in evaluating why certain protocols work better in one environment compared to another. The key features of ethnographic evaluation are the cultural focus, which centers on group behaviors, norms, and interaction. The participant observation is the evaluator is both an observer and the participant in group activities. It has long-term engagement, and it often requires months or years of immersion to truly understand the setting. Its rich qualitative data gathers in-depth insights through interviews, observations, and analysis. It has its benefits. It has a deep cultural understanding, which provides a comprehensive view of a group's internal dynamics. It has a holistic approach which captures not just behaviors, but also the meaning and motivation behind actions. Its contextual insights offers highly specific insights relevant to the setting being studied. It has also its limitations. Its time and resource intensiveness requires long-term immersion, making it impractical for many situations. It has a limited generalizability, which provides results that are often specific to that particular group, limiting broader application. And prolonged immersion can lead challenges in maintaining objectivity. Let us review some studies which use the ethnographic approach. A study on evaluation in telehealthcare utilized the ethnographic approach. The evaluation and the workability of the telehealthcare helps define their existing clinical practices so they can anticipate changes in ways that permit measurement. And this was an adjunct to the measurement of their quantitative outcomes. There were 3 research studies that evaluated the effects on the perception in adults' attitude with the purpose to improve the healthcare provided to children were done through the ethnographic approach. Now let us compare these 3 approaches. The Eisner-Connorship model focuses on aesthetic judgment based on expert critique. The role of the evaluator is he or she is the expert connoisseur. The key data is gathered through qualitative observations and narrative description. The next is the naturalistic evaluation, where the focus is the participants' perspectives in natural settings, and the role of the evaluator is he or she is a participant observer. Its key data are gathered through interviews and document analysis. The ethnographic evaluation focuses on cultural and social dynamics. The role of the evaluator is an immersive participant observer. The key data are gathered through field notes, interviews, and participation. Here is a table summarizing the difference of each approach. Here are our references. Thank you very much.